Hello, this is Dr. David Green, CEO of the Ohio Pain Network. Today's topic is what you need to know about trigger point injections. The trigger point is a tender and painful area of muscle. It represents a hyper-irritable spot in the muscle associated with palpable nodules in taut bands of muscle fibers. These may manifest as tension headache, tinnitus, TMJ pain, decreased range of motion in the legs, and low back pain. Usually palpation of the trigger point elicits pain directly over the affected area, and it can cause pain to radiate. Trigger point injection is an outpatient injection given into the trigger point. It could just be dry needling, it could be numbing medicine, and also possibly some steroid. You don't need image guidance for this as a superficial injection. The needle does not go very deep. The injection helps various things. One would be myofascial pain, which is chronic pain in muscle tissue. Fibromyalgia benefits, tension headaches, tinnitus, TMJ pain, and low back spasms. As you can see in this diagram, there are potential tender points, trigger points, possible all over the mid-back and low back and neck area. How is the procedure performed? It's outpatient, just takes a few minutes, don't need image guidance. The needle is placed directly in the muscle area of tightness. Usually a small twitch is seen and felt by the physician. Because the needle itself can relieve pain, a lot of times they don't put anything in it, just dry needling, and that can be moved in and out of the affected area. Or numbing medicine and possibly some steroid can be injected, throughout the area of the trigger point. And the injection can be repeated every few weeks as necessary. What are the results? Well, the results are often excellent for relieving the pain. May need a repeat injection. There's really no large-scale studies looking at them. But the great news is that they are often effective with no medication, just dry needling. It's a very low-risk procedure, very high benefit. Patients typically do extremely well with these. The risks with trigger point injections are absolutely minimal. The needle is not put very deep. The worst risk is that it just may not work. There's a very slight risk of infection or an allergic reaction. If it's used too often, the steroid can absorb some of the fat in the area and leave a skin dent. The top non-operative pain management in Ohio is through the Ohio Pain Network. There are several clinics participating and accepting over 50 insurances and providing over 25 different treatment options with the board-certified physicians. Visit us online today at ohiopainnetwork.com and then call us for more information and scheduling at 888-466-9898. I'm Dr. David Green with the Ohio Pain Network. Your pain stops here.